The Elijah-Alavi Foundation was founded in my son's memory to ensure that all infants and children with severe food allergies and asthma have a safe space to learn and to socialize in daycare centers and school.
Well, what it means fundamentally is adding a new layer of health and safety and a reassurance for parents that their children will be safe. As it happens, many children and their parents don't even know that they have an allergy. Childcare is a new experience. They're exposed to new foods, new activities. And so it might be something sudden that just comes up. So what this policy does is it requires all licensed and registered programs, child daycare programs in New York State, to develop a healthcare plan that includes how to prevent known allergens, but also how to recognize the signs and symptoms of an allergic reaction, and then what to do about it.
On November 3rd, 2017, my son Elijah was at his childcare center, and they fed him a food that contained an allergen that caused him to go into anaphylactic shock. And soon after that, even in our grief, my wife and I, we decided to just work, tirelessly to, with our local officials, our Assemblyman Al Taylor and now Lieutenant Governor Brian Benjamin, to put together a piece of legislation that would provide this added protection and guidance for childcare centers throughout New York State.
So it's a real testimony to the Silvera family to not just grieve, but to out of that be energized to make a difference so that the lives of other children in the future can be saved. It's a lot of kids. We're talking about the capacity of close to 500,000 children in the state of New York that this could potentially influence. Childcare centers, home-based childcare, school-age childcare. It covers the gamut.
Children who are diagnosed with allergies rely on these caregivers, in the event of exposure to an allergen that they understand how to react or to mitigate any risk. So having an epinephrine auto-injector on hand, these educators being equipped and knowledgeable and understand how to use it can save so many lives.
So there has to be a plan. To accompany that plan, we require training on recognizing the signs and symptoms and what to do about it. It's an online training. It's free to childcare providers. It's about a 30-minute training, and it gives them the information they need, the tools they need to be ready to intervene in the case of an emergency. To add on to what Thomas was saying, we're partnering with Health First to make 2 non-patient specific epinephrine auto-injectors available to every one of those 14,000 programs that take the training, so that they have those epinephrine devices on hand, know how to use them, and will be comfortable and confident to use them in the case of an emergency.
And with OCFS having their training that these educators can access for free, and also get access to free epinephrine auto-injector, it's so imperative that they understand the severity of having these life-saving information and epinephrine auto-injector at their school in the event they need to save a child's life.
We hope that other states follow our example, see the impact that a law like this can have, and embrace it on their own terms.
You can find out more information about our foundation at the Elijah-Alavi Foundation.org.
And if you would like more information about this free training for daycare centers, head over to the website. We have it's a long website. No, there it is. OCFS. That's right there. OCFS.ny.gov, or you can head to Elijah's webpage. That's the Elijah Silvera Foundation.